It is June 11th, the date of the session that we're starting. The session is called The More You Know, the Americans with Disabilities Act, ADA, Access to Healthcare in the Current Pandemic and Post-COVID. I'm Donna DeStefano. I'm with the Tennessee Disability Coalition. I will introduce myself and then I will have the other presenters introduce themselves. Okay, so as I said, I'm Donna DeStefano with the Tennessee Disability Coalition, and I'm glad to have you here. I am a white female who is, I have decided I will say now in the senior category, although I'm feeling not that old. I have gray-brown hair and glasses. And the background you should see, you should just be seeing my screen, which has the presentation on it. And the pronouns I use are she, her, and hers. And I'm going to turn it over to Brian Keller.
Hi, I am Brian Keller. I'm the Public Policy and Voting Attorney at Disability Rights Tennessee. I am a youngish white guy with blonde hair, clear plastic glasses, and a beard. I'm wearing a black and white striped shirt, and my background is an empty room with gray walls. You'd think after a year working in here I'd have something on the walls, but I don't yet. My pronouns are he and him.
Okay, thank you. And Marty?
Hi, everybody. I'm Marty Lafferty. I'm director of the Accessibility Project at the Civil Rights Education and Enforcement Center. I think I've made it to middle age now. So I'm a middle-aged woman with dark brown hair, glasses. I'm wearing kind of a multicolored checked shirt. Like Brian, my background is just a white wall, and I use the pronouns she, her, hers.
Thank you, Marty. And Sherry?
Hi, I'm Sherry Wilds. I'm the Assistant Legal Director and Director of Pro Bono and Legal Interns at Disability Rights Tennessee. And I am an upper middle age white female on the upper end of middle age. And I have dark blonde hair, short blonde hair, glasses, and I'm wearing a red and black shirt. And my background's just basically a wall and some wrought iron draping. Oh, and my pronouns are she, her, hers. Thanks.
Thank you, Sherry. And we are having some trouble with the captioning. I just made the interpreter an attendee again. So hopefully people can go in, find the attendee, and then make him pin that to your screen. And if not,
Donna, I don't believe the attendees can see each other. So that will not work. We need to work on it on a panelist basis.
I think there's another option for the captioning. I think if the attendees turn on the closed caption, it should just show up. You shouldn't have to pin the captioner, and it should be a little button on your right that says CC closed caption, I think.
At the bottom of the screen on the right, that's correct.
Yes, and while we're doing accessibility stuff, I'll let you know on this first slide that we have, in addition to all the other information that Donna read, we have 3 logos. We have a logo for CREEC, the Civil Rights Education and Enforcement Center. That's all it says. It's maroon, and it has a little line between CREEC and Civil Rights Education and Enforcement Center. We have the logo for Disability Rights Tennessee, which is this lovely multicolored asterisk. And the rights part of Disability Rights Tennessee is, I think, turquoise, maybe light blue. And then we have the Tennessee Disability Coalition logo, which is the words and then some nice geese on a white background, and they're all flying together.
Thank you very much, Marty. I'm gonna put the interpreter back to a panelist because
has to be, because otherwise people can't see him.
Yes, because we heard from somebody else that said the captions are working. Click on CC on the bottom of your screen, they'll show up. Okay, so thank you. Sorry for the technical challenges, and if we get more, we will continue to try to fix those. So I'm going to move on with the presentation. The second slide is why this session. Well, we decided that as people were not being able to access healthcare as COVID started, full healthcare, that this was a critical issue. So the importance of access to healthcare for all, meaning all, was very important for us to be able to share this information. The impact of the COVID pandemic on the civil rights of people with disabilities is something that we feel that people need to know about and know their rights and responsibilities. And it's important because civil rights don't disappear in an emergency. And as a matter of fact, the Health and Human Services with the United States Health and Human Services Office of Civil Rights issued guidance on non-discrimination early in the pandemic at the end of March of 2020. And this reference is going to be with some of the other references that we have at the end of the session. I do need to go back for just a minute and let you know the session is being recorded. Some of the people that were on early probably heard that. We are recording it. We will be sending it out to participants and posting it to the Tennessee Disability Coalition website and sending it out to other folks after the presentation. If you have questions, please put them in the Q&A. The chat has been disabled for this session, so you need to use the Q&A box. And we have allotted time at the end of the session to address questions. If for some reason we run out of time, we'll take the questions that are in the Q&A box and respond to those and get those responses out to everybody after the session. Oops, sorry. The agenda for today, I'm going to just briefly go over what we're going to be talking about. We'll be talking about lessons learned as part of COVID. We're going to talk about some general ADA concepts, the applicability of Tennessee's 2020 crisis standards of care, compassionate care, and accommodations. Moving on to slide 4, we'll talk about training. Your voice is important. Post-COVID, and then we will share resources on the ADA and COVID-19. Again, there'll be time for questions at the end of the presentation, but you can go ahead and put your questions into the Q&A anytime during the presentation. So briefly, I'm going to talk about these lessons learned. We're going to address each of these topics and expand on them as we go through the presentation. The first thing is that civil rights protections and responsibilities still apply even during emergencies. We have found out as COVID started that the guidance was discriminatory towards people with disabilities, the guidance that we have in Tennessee. As we worked through the issues, it's important that folks know that people should not be being discriminated against as the issues were being worked through. Advocacy has been critical, and COVID gave us a new situation. And we had to take a look at some basic problem solving to think about what we needed to do and how we needed to advocate to ensure that people's civil rights were still being protected during the emergency. We were dealing with some very concrete situations of what happened during COVID, and the specifics really helped to inform what needed to change. And then we learned that there's some really good things that we learned that will help us moving forward in the future for preparedness. The next slide, slide 6, I'm going to talk briefly about the ADA National Network. It is a network that provides information, guidance, and training on the Americans with Disabilities Act. After the ADA law was passed in 1990, the federal government funded a network of 10 regional ADA centers across the United States. Those centers have over 2,200 affiliates at the local, state, and regional level. This is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. There is a toll-free number that is 1-800-949-4232, as well as a website, which is https://adata.org. That is in your presentation materials. On the slide, there is a depiction of the map of the United States that labels each of the 10 centers, highlighting in different colors the states that each center oversees. The Southeast ADA Center is part of the Southeast region, and we are Region 4. The center is a project of the Burton Blatt Institute at Syracuse University, and we have the link there to Syracuse, which is bbi.syr.edu. The Southeast Center serves 8 states in the Southeast region: Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. The Southeast ADA Center has one partner organization in each state, and in Tennessee, it's the Tennessee Disability Coalition. I know that there are other attendees on this webinar who are from some of the other partner organizations, and so appreciate their being here as well as the rest of you. I am briefly going to talk about the ADA, the Americans with Disabilities Act, the general requirements. And I always say to people, if there's one thing that you need to know, you know that it is about civil rights, and it's about non-discrimination. It is a civil rights law. It talks about physical accessibility, effective communication, and reasonable modification of policies, practices, and procedures. And that gets to our programmatic access. As I said, it became law in 1990, and it prohibits discrimination against individuals with disabilities in all areas of public life. The next slide, slide 9, we'll talk about the Tennessee 2020 Crisis Standards of Care, and Sherry is going to lead that information. So, Sherry?
Thank you, Donna. I'm going to start out by taking us to an uncomfortable place. It's a painfully difficult place, and that is March of 2020. If you can, for a moment, just think about what life was like in March of 2020. I don't guess I have to tell you, things were closing down. Our office was pretty much sent the message, take your things and go home. Schools were starting to shut down, and we were seeing horrific situations around the world and also in our own country, where hospitals were on the verge of being overrun by sick people and dying people, and they didn't have room. There were just some very terrible things going on. A legislator in Texas was saying, basically, let's sacrifice the elderly for the economy and the young people. And let's just keep on going business as usual. Talking a lot about herd immunity, and this is not herd immunity from a vaccine, it's herd immunity from lots of people getting COVID, some surviving, some not. And the day that that announcement was in the news from that particular legislator is the very day that our executive director at Disability Rights Tennessee sent me something and asked me to read it and take a look at it for possible discrimination. And it was called the guidance, and still is, the guidance for the ethical allocation of scarce resources during a community-wide public health emergency. And that's as declared by the governor of Tennessee. So what this was actual guidance from the Department of Health, and the guidance was developed by a fairly large group of people, including a lot of medical people. I don't think there was anyone that represented the disability community on that particular group that formed this. And this was done back, I believe, in 2016. So it had been around a while. This was pre-COVID. This was not done in response to COVID. This was just done in case there was an emergency and a pandemic in our state. Well, the particular concerns about that guidance was brought to us by the community, by agencies and people, and was brought to our attention too. And we were not aware of this guidance, and neither were a lot of groups. And when I started reading it, and it was some of the most depressing things ever, because what you're talking about here is triaging people for who may survive and who may not when you have a shortage. For example, at the time, ventilators were one of the things that were used for people who were having serious trouble breathing with COVID. And now I don't think they're using them as much, but at that time, that was kind of the standard practice for someone who was in those dire circumstances. And there was very serious concerns, and rightfully so, that we didn't have enough ventilators, and that there were going to might potentially have to be decisions made about who gets one and who doesn't. It's a horrible thing. Triaging is horrible, whether it's on a battlefield or in a hospital in Tennessee. But sometimes when you're running out of things, priorities have to be given. Now, here's the problem. In addition to the fact that it's just very disturbing to think about our healthcare being in that situation, it's also extremely disturbing that our particular guidelines had provisions in there for guiding doctors to decide who gets a ventilator and who doesn't when there's not enough. And sadly, and very disturbingly, certain types of disabilities, people with certain types of disabilities were going to be going to the back of the line to get a ventilator simply because of their disability. It's kind of shocking to think about, but it's true. For example, certain people with multiple sclerosis or traumatic brain injury who required someone to help them with their daily living skills, they automatically moved to the back of the line. So if a doctor saw someone who did not have that disability and someone who did, and they both needed a ventilator, according to these guidelines, the person would be excluded who had the disability. That is shocking, but that's what our guidelines said. Our agency, as well as other agencies, including CREEK, which Marty is with, and the Disability Coalition, Donna and Carol are with, as well as many other groups like the ARC and others, and people with disabilities were extremely upset about this, as we are and were. And so we had to figure out what to do about it. And we had to figure out what to do about it quickly, because if you take yourself back to that horrible time, and we're still in some of it, but not like it was in March and last year, things could happen very quickly. People all of a sudden could overrun a hospital, and they have to make these decisions. Fortunately, Tennessee did not get to that point that ventilators were having to be rationed, but we could have been at any moment. So there was a true sense of urgency on the part of all of us to get this resolved right away. And in the law and in legal work we do, typically you build a case, it takes time. You know, you sometimes have luxury of some time to make your case. In this situation, urgency was at the forefront. Lives were at stake. People with disabilities' lives were at stake, who we represent. So working with a great coalition of people. I just cannot say enough how much the disability community and agencies came together and worked on this issue and provided input on suggested changes and revisions to these guidelines, how important that was to us. Marty and Brian that are presenting today with me, the three of us were all attorneys. So, and Brian's going to talk a little bit about the negotiation piece. We took that piece and we worked on the language and did some of the legal pieces, but the other people that were not lawyers that were involved in this issue provided wonderful feedback and backing and brought insight into the process. So it was truly a team effort to try to get this issue resolved. So what we did is we put together a complaint with the Office of Civil Rights for the Department of Health and Human Services, OCR. I'll refer to it as OCR from here forward. And we drafted a complaint. A couple of other states had already been negotiating with OCR on complaints they had written on similar issues. Since these guidelines were from the state, each state has their own set of guidelines. We were among probably some of the worst as far as the wording and the discriminatory piece of the guidelines in the country, but there were some states that maybe you could argue were even worse than ours. One state had, if people, just because you had an intellectual disability, you were moved down the line for a ventilator just because you had that. So it was bad. So we drafted an OCR complaint. OCR had very early in the pandemic issued guidelines that basically said you can't discriminate. So that was helpful that they did that. I think, they were seeing these issues come up. And so they issued those guidelines pretty quickly, which also is unusual. Usually that takes time, but I think they also saw the urgency. And so we began, the negotiation process, which Brian is going to talk a little bit more about, with the Tennessee Department of Health, with the Attorney General's office, and the governor's office, and to try to help these guidelines change so that people with disabilities would not be discriminated against, would have the same access to medical equipment that they needed for life-saving, for saving their lives during this crisis. And here forward, these guidelines are not just for COVID-19. So I'm going to turn that over to Brian, who's going to talk a little bit about the negotiation process and how we work together with also state agencies and others, and to wind up with some much better language, much better protections for persons with disabilities, plus some things related to visitors. Brian?
This is Marty. Can I break in for I just want to add a couple things. So everything Sherry said is right, and we all enjoyed working together to get this big change for Tennessee. Just to help paint the picture a little bit about how bad things were, the issue was not just rationing ventilators, which was certainly bad enough, but also just even getting somebody into the door for treatment for COVID at all if you had a disability. And so the guidelines were prioritizing basic care for people. Some of the people in the most dire situations were people with disabilities who had been living on ventilators for many years, had been living full and productive lives. And these guidelines put those folks to the back of the line so that if they showed up at the hospital, they might not even get in. And there was this kind of ableist assumption that quality of life for people with disabilities is not the same as for people without disabilities. And particularly that people who were already on ventilators or had really serious, what people perceived as serious disabilities, really had poor quality of life, and therefore got to be at the bottom of the line for these things. So all of that was concerning, and we were all hearing from people with disabilities and their families I don't know if my family member gets sick or if I get sick and I go to the hospital, I think I'll be turned away. And that was really a very scary thing. The other thing I'll say about the guidelines themselves, they were very bad, as Sherry mentioned, to the point that at the beginning, when there was a statement about just basic access to healthcare, it talked about respect for human dignity, and it talked about people having inherent dignity and moral worth, and it listed all of these categories like race, gender, creed, etc. It left out disability completely. And so one of our edits was just to even put that framing in the standards of care so that there was an understanding from the very beginning, people with disabilities need to be at this table as well. And we need to make sure that all of these decisions are being made on a non-discriminatory basis. So I think that's probably a good place for Brian to pick up, but I just wanted to add those things.
Thank you, Marty.
Yeah, thank you, Marty. So one more thing to add, I guess, to the context of this is that we were contacted pretty early on in this process by some national organizations that were working on this in a bunch of different states. The guidance that we had, the Tennessee guidance, is not something that Tennessee had just made up on their own. They had used what was called the Minnesota model. It was guidance that was pretty largely based on guidance that Minnesota had come up with, I think in response to the swine flu epidemics in the late early 2000s. And so part of what we were doing was to untangle that, and then to work with these national organizations that were kind of coordinating amongst states to challenge concepts in the Minnesota model, like Marty mentioned, that quality of life for people with disabilities is lower, and that we are somehow valued less. So we negotiated the resolution. Marty and Sherry and I dug through a bunch of other states' guidance, and we kind of found things that we liked here and there, and we pulled bits and pieces out and put it together, and we sent a draft over, and then there was a lot of talking, and we had to negotiate both with the state and with the feds to whom we had made the complaint. And so that process, I have been in much more tense negotiations than that. Most of what we were asking for were things that we knew we would probably get. What we needed it now, and we needed it quickly and with some urgency. Everybody involved had a lot on their plates and had a lot to think about and work on in that moment in the early pandemic. And I had some tough conversations, especially with the state, about all of the other things that they had going on that they needed to think about and worry about and focus on. We also had to negotiate with the federal government, who had kind of made this a priority to do quickly, and we had heard that they hadn't always involved the disability community in resolutions of complaints in other states. And so we worked very hard. Marty sent lots of follow-up emails to the federal government, really making sure that we wanted a place at this table, that we wanted to be part of this conversation. And that's what ultimately happened. Over the course of probably a month and a half, I should have gone back and looked at the timelines here, but several weeks and lots of phone conversations and short little emails, we got pretty much everything we asked for. Everything that Marty and Sherry and I had put into that draft request found its way there. There were even a couple of places where we found like a sentence or two that we liked, and we decided to put it in. We said, this needs to be in here somewhere, and we couldn't figure out where to put it, and we said, well, let's just put it everywhere. We'll let the Department of Health figure out where it really should go. And when we got the draft back, it had it in all the places we had put it, which is great because it's just that many more reminders as you're reading the document that you need to be respectful of people with disabilities. And the specific things that we were asking for, it was kind of a philosophical shift from the original guidance, but in other ways it wasn't. So the original guidance had categorical exclusions, list of certain disabilities that if you had one of those disabilities, you were out. What we asked for is that the decision about who gets care when there aren't enough ventilators should be based on how likely an individual is to survive that medical episode, and not necessarily based on their disability at all. The only question is, if we give this person a ventilator, will it help them? And then that's how healthcare providers should make those choices. We also were really worried about a lot of other context here. It wasn't just this one issue. So we were seeing news reports all the time of medical students graduating early and going out into the field to start practicing. So we were thinking about someone who had barely finished medical school showing up and making these important triage decisions about people with disabilities. We were thinking about visitor rules. So very early in the pandemic, I got a call from a woman who's very involved in the disability community here, and she has a son who has autism. And she asked me, she said, Brian, like, if my son gets this disease and has to go to the hospital, what should I do? Can I go with him? Hospitals aren't allowing visitors. What should I do? And so I didn't really know what to do. So I just picked up the phone and called the hospital and asked. And I talked to their chief nursing officer at the hospital that she would take her son to. And I said, you know, I got this question. I don't really know what to tell them. What do you think? And hospitals were starting to kind of figure out that people needed to be there. We have friends who had children who gave birth during the pandemic, and a lot of times their partners weren't able to be there with them during the birth of their children. Hospitals were starting to figure out that that kind of thing is important. So what we learned very quickly in the bullet points here, we're talking about hospital visits. Planning was really necessary. And DRT worked with a couple of other groups to put out some really rough, quick guidance on how to handle this situation. And the first thing we said is go to their website and read their rules. Because we found that a lot of hospitals had rules on their website that said, no visitors except for these certain situations, and those certain situations usually involved children or individuals with disabilities. And we told them, we told folks to pull that up on their phone and bring it with them so that they could show whoever is at the front desk saying, you know, you can't come back, I'm sorry. And we put out a document that basically just said that. As much as we would love to help everybody in that situation, we were really worried that we would get so many calls, we wouldn't be able to pick up the phone and call individually for everybody. So we worked on this document to try and explain this, and we tried to get it out as broadly as we could to help other people walk through that same process that I had been through pretty quickly. So we also added language in the document, in the crisis standards of care, that made sure that hospitals knew that they needed to allow certain kinds of visitors, especially when there's critical decision making involved. Is there another slide for me? I'm drawing a blank. Donna, is there another slide for me, or am I good? We move into Marty now.
The only thing I wanted to add to that, Brian, is just how really the Department of Health and the governor's office did. I just want to reiterate how much they did cooperate and work together with us, and also that OCR worked with us in making sure that, you know, the discrimination provisions in that guidance were eliminated and at least replaced with something that was better and provided what was needed for people with disabilities, and that not being a factor in exclusion. And the other thing I wanted to say, we built a little bit on the ones that had already started negotiating, and that since we've done this, other states have also revised their guidelines, and they kind of built on what we've done and did something that's maybe even more geared for their state and their issues. So it's more than just a state cooperation. It's a national sort of cooperation, in that we all kind of are able to use each other's information and revisions to help improve our own states, which I think is a very important thing to keep in mind when you're trying to get change. And the only other lesson I would say learned from this particular events with the guidance is how important it is for decision makers to include people with disabilities and groups that represent people with disabilities when these things are developed, when they are starting to develop and form committees to work on things like this guidance, and it's going to affect people with disabilities, to include the stakeholders early so we don't have another last minute crisis or situation where this all comes crashing. So that, and as persons with disabilities and representatives of persons with disabilities, try to speak up and offer to be a part of any of those kind of decisions, offer to be on those committees, let your opinions and voices be heard. I think we're going to touch on the vaccines also, but we can do that.
That's a great point.
Yeah. This is Marty. I think I can add on to the vaccines down at the bottom. Did you have something else, Brian? Go ahead.
Yeah, well, I was just going to say, you know, that's a great point, Sherry, and it's worth emphasizing the state-specific nature of the negotiations. Even though we were working with national organizations, me and Sherry and Marty really took the lead in Tennessee, and we worked very closely with people we have worked with on other issues to get this. And so the governor's office, the COVID Unified Command Task Force, worked really closely with us, and they really were very cooperative, partly because we already had those relationships. We weren't strangers coming in saying, hey, give us all these things. We're at those tables pretty frequently, and that really helped move this along quickly. It was a really big deal. One of the things we were really worried about was another state that had filed a complaint learned that their complaint had been resolved in the news. And so we told them very early and quite often that we want to know about a resolution before it leaks to the news. We want to know about it first. And they did that. We were involved in the resolution in a way that not every other state had been.
Thank you, Brian. This is Marty. I want to tag on to a couple of things that people have said already throughout, and then I'll connect it up to the accommodations that I'm going to be talking about. I'll go back to what Donna said at the very beginning. That's an important concept. Civil rights are not suspended during pandemics or emergencies, and that includes the Americans with Disabilities Act. And there were a lot of myths going around back in March and early 2020 that somehow the ADA didn't really apply in this situation. It was new, it was an emergency, so the ADA did not apply, and that's just not true. And so one of the things all of us working together, the lawyers and the advocates, we're doing was educating policymakers and educating potential patients and family members. You do still have these rights under the ADA. They're not gone, and we will help make sure that they're enforced. The other element of this is something that was emphasized by Sherry. This was a crisis situation, an emergency situation. And, you know, we deal with a lot of different essential, critical issues as disability rights attorneys, but we typically don't have the kind of emergency that somebody could die if we don't get it resolved quickly. And in this situation, I mean, we came together and we were having meetings every day and emails every day and just constantly doing something, because the consequences of not getting these healthcare guidelines changed could have been deadly for people. So those two things. And then my slide itself, I'm going to read you what it says, and then I'll go over these and tie them up with COVID and also the healthcare guidelines. It's accommodations. I'm going to be talking about reasonable accommodations, effective communications and auxiliary aids and services, rights in virtual settings, program access and access to services, and then I'll touch on vaccines, including administrative barriers and multiple ways to access vaccines and accommodate people. So accommodations were present in all of our minds throughout the negotiations about the healthcare guidelines, as was non-discrimination. The guidelines themselves were discriminatory and were actually going to exclude people based on their disability, as Brian said. Part of getting rid of that discriminatory lens was to build in, you know, the framework of people with disabilities have value. People with disabilities should not be discriminated against. And then how do you do that? Well, you've got to do some accommodations. One of the things I think we were all horrified to see as part of the guidelines, there's this thing called the SOFA assessment. And it's not about a couch. It stands for Sequential Organ Failure Assessment. And it was this tool that's used across the country and that was used in these guidelines to assess people for whether they got care or did not during the pandemic and during other emergencies. And so one of the things we built in when we were helping revise these guidelines was the key concept. There would have to be accommodations made during the assessment for people with disabilities. And including that patients with disabilities might not be able to be assessed under all components of this SOFA. So for example, we said that a person who's deaf may not be able to respond to a verbal command to move his or her eyes and speak. And that was one of the things that they were going to use to determine, did you get care? We also noted that a person with a mobility or cognitive disability might not be able to respond to a verbal command to move a body part or their eyes. You know, in some cases, there should not be a score or points attributable to things like having an acute injury. So, for example, a person who's a chronic ventilator user is not going to meet the same standard as somebody with an acute injury. So we wanted to make sure all of these things were being looked at with a disability perspective in mind. And the other thing I'll add about just the revision to the guidelines, I think this in some ways was not happening in the other states, and because of the relationships here, and particularly Brian has done a great job, and Disability Rights Tennessee has done a great job developing relationships with governmental entities, and including the Department of Health. They didn't just take our input, they let us redline the document. And I mean, we marked this thing up and we rewrote significant sections of it, and they took that markup. And I think those relationships were key, as well as the approach we took, because we took an approach of, we've noticed a problem here. It's going to impact people with disabilities. Let us help you. Let us work together to fix it, because we know, Department of Health, that you don't mean to be discriminating against people with disabilities. And so I think that approach was very helpful here. Going back to the slide, reasonable accommodations generally, we were hearing from hospitals that, and people who were going to hospitals, that, you know, they weren't going to allow the visitors, as Brian said, allowing visitors for people with disabilities, allowing interpreters, allowing companions for people with disabilities is a reasonable accommodation that's required under the Americans with Disabilities Act and other laws. And so we were able to get the word out about that, both in the context of these guidelines, but just generally on, hey, how do you get the person the care they need? And also, how do you make sure they're actually having the accommodations that they need in a healthcare setting. I got a couple calls during this time period from folks who had relatives or friends in long-term care facilities. And the same issue was coming up. They had been going to help the relative, for example, in a long-term care facility, help that person be able to communicate with the staff, be able to speak up for themselves, being able to explain various things and advocate for them. And suddenly the facilities were telling them nobody else can come in, no visitors because of COVID. And we were able to help explain that these rights still were in place so that those folks could go in and help their friends and loved ones. There's a lot of pushback and still is to some degree about effective communication in on-site settings because of the pandemic and because of contagion, et cetera. And so we were having people say, we can't allow an on-site interpreter during this time. And that's not true. People who are deaf and hard of hearing have the right to effective communication, and who have other communication disabilities have the right to effective communication. It's the obligation of medical providers to provide that. And as I mentioned, it is not suspended during pandemics. In some instances, folks were able to use a video remote interpreter or something like that instead of bringing an interpreter on site. And if that's effective, great. But when it's not, an on-site interpreter is absolutely a valid thing to ask for and would be required to ensure the effective communication. The goal is to make sure the effective communication is happening, and the hospital doesn't just get to say, oh, well, COVID, you don't get an interpreter, which is what some of them were trying to do. The same rights, and this is something I think a lot of people didn't realize, and maybe still don't. You have the same rights to non-discrimination and reasonable accommodation and effective communication in virtual settings as you do in actual physical settings. So I know there were a lot of telehealth visits during the pandemic, and to some degree still are. So if somebody is going to be talking with their doctor over a computer, you still have a right to accommodations. So one of those accommodations might be that a friend or relative is sitting with you to help you during that conversation. Another one may be that you get a sign language interpreter, and it can be an interpreter like we have here today who's showing up on the computer. So those are still things that are required, or you might need the captioning or something like that for your medical appointment. All of those things still should be provided in a virtual setting, and there could be other things as well. As Donna mentioned, we're talking about not just physical access, but access to programs and services. And so the key is, are you able to access the programs and services? Not necessarily are you able to access them physically by going to the location. An issue that came up quite a bit, some folks with disabilities had disability-related reasons that they might not be able to wear a mask, and that's fine. We're not, you don't want to force somebody with a disability to wear a mask if it's going to harm their health. However, if you're a person with a disability couldn't wear a mask, that doesn't mean that you get to just go into a doctor's office if they have a mask rule. You may then be accommodated by getting services virtually or in some other manner. And so that's kind of how these things kind of work together. Doctors' offices and other businesses are allowed to have these rules that protect health, but they still have to make accommodations for people with disabilities. And I'll touch on the vaccines that have come up a little bit, but we haven't really talked about in detail. You all remember when the vaccines were first starting to roll out, really at the beginning of this year here in 2021, there were so many different guidelines about who could get one, what age you were, what age you were, what vulnerability you were, et cetera, et cetera. One of the really great things Tennessee did that we want to give credit for is Tennessee early on, and because of a lot of advocacy around that from the Coalition and Disability Rights Tennessee and other groups, prioritized people with intellectual and developmental disabilities who can't live alone for being vaccinated. And that was great. There's quite a bit of research out there showing that people with intellectual and developmental disabilities are at higher risk for contracting COVID. So this was great that this group was prioritized. The criteria continued to change, and at this point, pretty much anybody is eligible to get a vaccine, which is wonderful. And yet there can still be some barriers to doing that. So if you're deaf or hard of hearing and you're going to get a vaccine and you need an interpreter for that process, absolutely ask for one, and you do have a right to have one. And it's not just going and getting a shot, but you're being explained, why you're getting this shot, what kind of shot it is, what kind of side effects you might be able to expect. So those kind of things. The other thing is, where you're going to be able to get the shot. Is the building accessible? Those kind of things. So you absolutely have a right to get the vaccine in an accessible location, and to get any kinds of auxiliary aids and services that you might need. Some of the places don't want you to take along a companion with you to get the vaccine, but if you need that due to disability, you can absolutely do that.
Great. Thank you, Marty. We're going to go to the next slide for Brian to talk a bit about the training that's been done.
Yes. So what has been done during COVID, Tennessee Bar Association training, DRT, I gave a similar webinar to the Tennessee Bar Association quite a while ago now, last summer or fall, with a couple of individuals from Vanderbilt Medical Center who had been part of the original group that designed and implemented this this guidance, and that was a great session because we got to kind of talk about, from my perspective as an advocate and as an individual with disability, what the new guidance meant to us, and then also they got to talk from the perspective of people running a hospital every day and making important decisions, how they approached implementing this new guidance. And then we also have done trainings on standards of care. We have shared the standards of care with hospitals and doctors' offices and clinics, making sure that everybody knows what these new standards of care are. Fortunately, we never had to use these new standards of care. We never got to a place in Tennessee where we had to ration health care. We are very grateful for that, and very happy that we didn't actually have to use all of this hard work. But if we ever get to that place again, whether it's this pandemic or a different one, we will be ready and the educational materials will be out there. And then in the future, we're going to continue reaching out and training people to let them know, along with the Department of Health, hospitals, doctors' offices and clinics. Important note here, it's not just the State Department of Health, but a handful of counties have county departments of health. And one of the counties' Department of Health had the old guidance on their website for a long, long time. And we kind of had to tell the state to tell them to take it down, because when you Googled it, it was still up there. So there are lots of smaller organizations that need to know about the new guidance, need to know that the new guidance exists and the old guidance shouldn't be used anymore. And then we're going to keep doing things like this, training about disability in general, explaining accommodations that may be necessary, how to interact with people with disabilities, what to expect. And hopefully we can start through those conversations, start to dispel some of the myths about quality of life or value as an individual.
I've got a quick thing to add about the vaccine piece and access to that. Disability Rights Tennessee and all the protection and advocacies like us around the country have received grants to further the education and youth around vaccines for people with disabilities, and to try to help in any way we can to make sure folks who want vaccines have access to those. And a couple of things we're looking at are people in congregate care, like residential settings, that may not be aware that they have a right to get a vaccine and need to get a vaccine. We've been made aware of situations in juvenile facilities now that young people are able to get the vaccines that they hadn't been offered them in juvenile detention facilities, have not even been offered those kind of things like, do you want to take a vaccine? And so that's a concern. And also people in those residential settings that, like Marty said, may need interpreting to understand that they have a right to get a vaccine. They may not even know that the categories are open now. So we just want to emphasize that now that we're in this sort of next phase of this pandemic, that everyone be vigilant to make sure that people have access to the vaccines. Thanks.
That's a perfect lead into the next slide about people's voices being important. And I think Sherry or Brian, you were going to talk about this.
Yes, I wanted to say how extremely important it is for people with disabilities and people in the disability community and that represent people with disabilities to be at the table early on. I mean, this is one of those situations with the guidelines where we were on the back end and having to really rush and try to get these things resolved. Volunteer to be on any kind of task force or committees, and those agencies and state agencies and others that are the decision makers and make these kind of decisions, be sure and include the stakeholders, which often maybe people with disabilities are some of the stakeholders. Include them early on. I don't, like Marty said, I don't think, or maybe it was Brian, that when these guidelines were developed, they really intended to discriminate. I don't think they probably had the right people at the table to address that issue to start with. I'm not sure that anybody raised the issue while they were developing these guidelines. So it's just so very important to speak up.
Great. Thank you.
Yeah, that is really important. It's also worth noting that Tennessee was the first state to include people with developmental disabilities who can't live alone in the vaccine list, the top tier for the vaccine list. And self-advocates played a very important role in getting themselves on that vaccine list. And so your voice really does matter, and it does change things. I know sometimes it's really easy to think that what can you change? You're just one person. But the truth is, it really does matter. And volunteer on things before there's a crisis, before there's a natural disaster or a pandemic, because those organizations, committees, those boards that you're already on are the ones that are going to step up and start working when there is a crisis. And so if you want to be there for your community during a crisis, be there when there's not a crisis. It really does help to have those relationships and to be in those roles ahead of time.
Great. Thanks, Brian and Sherry. And Marty's going to talk a little bit of the post-COVID, a little bit about the post-COVID world.
Yes. So first, please help us to continue to get to the post-COVID world. If you're eligible for a vaccine and it's safe for you to get a vaccine, please get a vaccine so that we can keep moving post-COVID and make this thing a part of dark history for the United States and the world. As we move post-COVID, keep in mind that all of the issues we're talking about are still important in healthcare. I mean, there may be other emergencies, there may be other crises, but even if not, we need to make sure people have access to healthcare and that people with disabilities have the same access to healthcare as everyone else. The Department of Justice is taking some leadership on this issue. They've issued a statement fairly recently, and it's talking about COVID and making sure people have access to vaccines and other things during COVID, but it's going to be applicable post-COVID as well. One of the things that it talks about is principles to assist in non-discrimination obligations. And it makes sure that one of the principles is ensuring equal access for people with disabilities and avoiding disability discrimination. It talks about crisis standards of care, visitation, vaccine distribution, all of those things, and making sure that there are accommodations and modifications, physical access, and effective communication, and all of those things are going to be important for the rest of our lives and in the future, because healthcare is so critical to everyone. And we just need to make sure that we continue doing this. We don't want to forget about what happened here. We don't want it to happen again. We don't want COVID to happen again, but we also don't want to get to a point where something else happens and we think, oh my gosh, there's some bad guidance in place, or oh my gosh, somebody has a rule that's going to hurt people with disabilities. So that ties back in to what Brian and Sherry were saying about making sure that people with disabilities, their advocates, and other folks who care about people with disabilities are at the table, because otherwise these things are not going to change. And we need to keep training about these things and making sure, Brian mentioned that we kept finding old copies of the old guidelines at various health departments and online. And I think they're gone now, but they may show back up because unfortunately, living in the internet age, things don't really ever go away. You'll see a link to the correct guidelines at the end of the slides, and it'll be in your resource packet. But I'll tell you, if you see guidelines called Guidance for Ethical Allocation of Scarce Resources, and it's the Tennessee guidelines, and it'll be called version 1.6, and it'll still have July 2016 on it. But the important part is that it also needs to say revised 2020. And if it's not the revised 2020, it is not the right version at all. So we want to keep getting the word out about that. Triage is technically happening all the time, whether there's an emergency or not, because there is not an unlimited amount of resources for medical care. And so we want to be vigilant and make sure that disability categorically is not being used to exclude people from healthcare. We want to make sure that actual factors about how is this treatment or this service going to benefit this person is what's being looked at, and then it's individual by individual, because, and I'm not sure if we made this clear before or not, but basically the guidelines were treating every person on a ventilator exactly the same, as if they were the same level of fragility or vulnerability to other things. Somebody who had multiple sclerosis, they were treating every person with multiple sclerosis as if they could not benefit from treatment. So we need to make sure people are being treated as individuals, not being discriminated against, and being accommodated.
Great. Thanks so much, Marty. I'm going to just recap the session that we just had and the information that was shared. Quite a bit of information in a short amount of time, I know. But we really wanted to be able to at least get some of the basic stuff and the important concepts there. We've certainly learned lessons. We wanted to share those with you. The ADA applies. There are some general concepts. Remember, it's a civil rights law and it's about non-discrimination. We talked about the applicability of the Tennessee 2020 crisis standards of care, and that is going to be important, as has been underscored by Marty and Brian and Sherry, that that people know about that it's not the old crisis standards that people are following, that they actually know about these and they're following. And that's where every one of us are ambassadors to help make that message come across in our world. Brian talked about compassionate care and what rights folks have for visitors in the hospital, even during an emergency like this pandemic. We talked about accommodations that need to be made. We talked about the importance of training for basically everybody to know about this information. And that is one of the major reasons why we decided that this needed to happen. This training needed to happen to help to get the word out. And it certainly isn't going to be the last training. And feel free to share the information and materials you get with anybody and everybody. Your voice is critically important, and I think the other presenters made that really clear, to be part of things pre-crisis stage, because if we can get those kinds of things in where folks with disabilities are thought about before anything happens, then the guidance, the materials, the resources, and it will be part of the forefront of medical care in this instance, and what healthcare workers and others know about, as well as individuals with disabilities and their families and important people in their lives. We talked about a post-COVID world. Certainly, this is a major pandemic that we have been in and continue to be in to a certain degree. It won't be the last. We know that. But we do know that we have put into place some critical things that needed to be in our crisis standards of care here in Tennessee, and others have done so across the nation. I know we have a number of people from different states that have been participating in this session today. So take a look at where your state is and what they have for crisis standards of care. There have been lots of updates that states have made, which is good. So I want to go through just the resources that are in your packet very briefly. I'm not going to spend a whole lot of time on these. I just want to call your attention to the fact that they're here. There are links. Everybody got the materials that registered before the session ahead of time so that you have those. Again, use them, share them. But the first resource we have is the guidance for ethical allocation of scarce resources during a community-wide public health emergency as declared by the governor of Tennessee. Now, this is specific to Tennessee. And as Marty pointed out, version 1.6, July 2016, revised 2020. That's the version that has the updates that was developed by the Tennessee Altered Standards of Care Work Group. And the link is on the slide and the page, the resources. The next page, page 18, slide 18, has a couple of other links. The first one is your rights to healthcare under the law, again, specific to Tennessee. There are links in PDF and text only that are on our TennesseeDisability.org website. The next resource is Hospital Visitor Tip Sheet for individuals with disabilities who need a support person, critically important. The Disability Rights Tennessee, Sherry and Brian's organization that they work for, our Tennessee Council on Developmental Disabilities, and the ARC of Tennessee worked on this. And that link is up on the DisabilityRightsTennessee.org website. And you'll see it on the slide and in your handout. Slide 19, continuing resources on the ADA and COVID-19. The first one is a statement and resource guide by Principal Deputy Assistant Attorney General, AG, for Civil Rights that addresses the ongoing civil rights challenges related to the COVID-19 pandemic. And that is on the justice.org, justice.gov site. It's pretty, it's an attorney general, so you've got some lawyerese in there. The next resource is our Health and Human Services Office of Civil Rights Bulletin. This is the one that I referred to prior that talks about civil rights, HIPAA, and the coronavirus 2019 that was issued very early on March 28th, 2020. And that's in the United States Department of Health and Human Services website. The next one is also on the Health and Human Services website. It is called the Office of Civil Rights Guidance on Federal Legal Standards Prohibiting Disability Discrimination in COVID-19 Vaccination Programs. And the last one on this page is COVID-19 Healthcare and the ADA that was presented. It was a ADA National Network presentation. And the link is there to adapresentations.org, and that specific link will bring you to the healthcare one. The next page, page 20, there's a few more resources. The first one is Care Systems COVID-19 Impact Assessment, Lessons Learned and Compelling Needs from the National Academy of Medicine. Has a lot of good information for you. The next one is Strategies for Helping Older Adults and People with Disabilities Access COVID-19 Vaccines. and that is from the Administration of Community Living.gov website. And the final resource that we have for you is vaccine access for people with disabilities, guidance, funding, strategies, and best practices. And this is in the archives for the ADA National Network webinar series. So that's at adapresentations.org in the archive there. And that's one of many great resources in those archives. So there might be some other things that you want to take a look at. Going to slide 21, contact information for all of the presenters today. For myself, Donna DeStefano, Brian Keller, Marty Lafferty, and Sherry Wilds is on this slide. It has our titles as we gave them to you at the beginning, and the organizations. Again, I am with the Tennessee Disability Coalition. It has my email and phone number. Brian Keller is with Disability Rights Tennessee, and there's a toll-free number to access him. Marty Lafferty is with Civil Rights Education and Enforcement Center, and there is her email and a phone number. And Sherry Wilds is also with Disability Rights Tennessee and can be contacted at their toll-free number. Now we're going to move into the questions and answers. This slide 22 has a picture of a large question mark that is walking, and a sort of sticky kind of figure with holding a key. The folks at the our Southeast ADA Center had initially put, I think, the screen together for a presentation, and so I have adopted it. So with that, I am going to ask Carol Westlake to help us. Let's see, we have about 10, 15 minutes maybe to go through some questions and answers that have come up.
Sure, I'm happy to do that. Thank you, panelists, for this presentation. It's really been helpful. We have just a few questions and comments. I'll start by sharing a comment made by one of our participants who points out that when you are needing to use interpretation in a healthcare setting, she says that friends and relatives should not be functioning as interpreters because they may get emotional and not practice impartiality. The suggestion is that it is best to get certified or well-trained interpreters. And I'm assuming, Marty, that would be high on your list.
Yes, that is exactly right. And so when I was talking about friends and family members, I was talking about as visitors or companions. Absolutely, the ADA does require that healthcare providers provide qualified interpreters. Tennessee does not require that the interpreters be certified, but some states do. So it's important that healthcare providers are following whatever guidance and laws are in their state. But yeah, absolutely. There are many hazards to having friends or family members try to interpret. And one of those is, you're right, you mentioned the impartiality, but also that, just because somebody knows sign language doesn't mean they're qualified to interpret for someone. Interpreting takes many years of training and lots of skills. And then there's the medical vocabulary. So thank you for adding that, whoever added that. That's a great point.
And
plus, there's the issue of privacy. The patient may not want family to know certain things. So that's also a concern.
good. And there's one other point here, is that if there is somebody accompanying a person, if a family member is accompanying the person and the family member happens to be deaf, that person is also able to access interpreter services if needed.
Yes, that is correct, and also a very good point. The law says that businesses, including healthcare providers, must provide effective communication to patients and their companions. So good point.
Great, thank you.
Great. Thank you. So then there are a couple of questions about getting a hold of a copy of the new guidance and its accessibility online. And I think that you all have that in the handouts that you sent and showed that on the slide. So I think that question is answered. And then we have just a final question, excuse me, not the final question, about where this event can be viewed again. Noting that it's being recorded, will it be available for revisiting?
Yes, and as I said at the beginning, we are recording it. We will make sure that everybody who has signed up for this training receives the link to that recording. It's also going to be on the Tennessee Disability Coalition website at tndisability.org, once we get it up, of course. And I know that the folks with the Southeast ADA Center are planning to put it on their COVID-19 resource page too.
Great, thank you. So there's another question. When we say support person, somebody with someone in a healthcare setting, is there documentation for this? Like, does there need to be a conservatorship or a POA, a power of attorney?
I can take that. This is Marty. There does not. If a person with a disability, comes in and says, I want this person to be with me for whatever reason, there does not have to be that kind of documentation. Healthcare providers will often try to insist on that sort of documentation, but it's definitely not something they have to require. One question the healthcare provider probably may ask is it okay for us to disclose healthcare information to this person? And certainly the patient needs to authorize that in some manner if they're able to do that, but it's not required that it be a POA or guardian or anything like that.
I would just add, and Marty, you may or may not agree with this, chime in if you do or don't. It may be helpful if when you ask to bring this person in, if they do help you with something related to your disability, if you want to go ahead and say that they do that, just to prevent the pushback, making it very clear that this is an accommodation.
This is Marty. I agree completely with that. Yes, if you're asking for a disability accommodation, saying that right up front is the best way to get it, because otherwise it could just seem like I want to bring a friend with me just because. And so there needs to be some relationship between the request for the accommodation and the disability. It might even help to go a step further and say something like, I have memory problems related to my disability, and my family member helps me remember things, remember questions I had at home, and remember the information provided, just as an example.
Great, thank you. So I think the last comment we have is that somebody was able to find the guidance by cutting and pasting that email address, the URL. So that is good. And at this point, that is the end of the questions.
Okay, thank you very much, Carol, for monitoring that. I will see if the presenters have any last minute things to add. We'll start with Marty.
Thanks, Donna. One addition I would like to make is thanking Donna so much for suggesting that we do this presentation and for helping us all organize our thoughts. We had an initial meeting where we were talking about all of these things, and Donna fortunately wrote down what we were talking about and helped us organize it and helped us put together the PowerPoint. So she has been the driving force behind the presentation. And I would also like to thank the Coalition and Disability Rights Tennessee for working together with Creek and others to get these guidelines changed and to get the word out about it, because none of us could have done it alone. It was a huge group effort that has been very successful. Thank you, guys.
Great. Thanks, Marty. I think your point about none of us can do it by ourselves is so important, and we can't. I know that we have appreciated all the attorneys at Disability Rights and at the Civil Rights and Education Enforcement Center for appreciating.
Yeah, so actually we've got a few more comments and questions that have come in. So
okay,
if you'll just give it a minute. First off, there's a thank you to our interpreters for interpreting. So thank you very much, interpreters. There's also a comment that says that we're encouraging people to take documentation from the Office of Civil Rights to them with the hospital if they're a support person or somebody that's going to be there, because many decision makers are not aware of the facility's responsibility, and it just is a helpful thing to do. And then there was a question about which is the best agency or agencies to go to first to get help when an employer is knowingly intimidating, discriminating, or retaliating against a person and violating their civil rights. So this is, sort of in the range of the ADA broadly. This is not absolutely insurance, but if somebody is denying them FMLA and medical care, for example, and is ignoring sort of the health documents that are presented by doctors. Is there a place to go to get help for that, particularly thinking about the fact that there are people who have long haul COVID impacts, if they've had COVID, for example, or other kinds of disabilities. So there's really this connection across healthcare to employment, particularly if you've had COVID exposure, quarantines, and or the impact of having the virus.
Disability Rights Tennessee does take some employment discrimination cases, but they can certainly call our 1-800 number, and if we can't help, we may be able to refer to someone who can.
And this is Marty. Civil Rights Education Enforcement Center does not help with employment issues. However, we do intake some referrals. So if it's outside of Tennessee, particularly, because go to Disability Rights Tennessee if it's in Tennessee and they'll get you to the right place. But if it's outside of Tennessee, feel free to contact Creek and we'll try to get you to the right place for your specific issue, as well as whatever state you're in. I should probably say this about Creek because I didn't at the beginning. I'm based here in Tennessee in Nashville. We're nationwide and have offices in several places, and so we do serve the whole country. So for those of you who are on from other states, feel free to reach out to us as well.
And in terms of information that we might be able to provide, the Tennessee Disability Coalition now is an ADA affiliate with the ADA National Network. And remember, we can help to be a resource to get you some information. We can't do any enforcement, but we can talk through what the issue might be and see about getting you some resources and potentially talk through some options that you might have to talk with the employer. And so again, the Tennessee Disability Coalition, if you're in Tennessee, and although I've got calls from outside, and I'll refer to my counterparts in other states, but if folks contact the toll-free number that I gave at the beginning for the ADA National Network, that will get you connected to your local, one of the 10 regional centers across the nation. The other good resource for this is the Job Accommodation Network. And I always forget their website, but I'll make sure to put a note to put that in the follow-up. They have a ton of resources for folks, and also are ones that you can contact directly to talk through employment issues.
And this is Marty. I found the website while you were talking, Donna.
Thank
and
you.
Get it to you, but it's askjan.org. So askjan.org.
Thanks, Marty. For some reason, it won't stick in my head. Any other questions, Carol?
Great. Nope. There's a couple of thank yous for the presentation, but there are no additional questions at this time.
Well, I want to thank all you attendees. I'm sorry we had some issues at the beginning with seeing the interpreter and seeing the captioning. We will take that and hopefully we will do better next time on making sure that that is up. But I'm glad that folks were able to access that. As we've talked about, it's critically important that we do have as effective communication, and sometimes we have some bumps along the road. But thank you for your patience in that. I appreciate everybody being here. As I said, we've got a lot of folks on this, and there's about 22 people from states other than Tennessee. So we thank you for being on that. We know that there was a lot of Tennessee specific information, but we do know that we also tried to provide other types of information in a more general in terms of this topic. And you know, please share the materials, and when you get the recording, please share that with anyone and everybody, because it really is going to take all of us being able to share these things to ensure that people with disabilities rights are upheld, and that people understand what the responsibilities are and where to go for assistance in being able to address those responsibilities. So with that, I have one more slide that just says thank you, along with our logos that were so aptly described before, with the Civil Rights Education and Enforcement Center, Marty Lafferty, Disability Rights Tennessee, Brian Keller and Sherry Wilds, and the Tennessee Disability Coalition, myself, Donna DeStefano, and Carol Westlake, helping us out to make sure that are monitor the chat and help us with some of the problem solving. Carol is the executive director of the Tennessee Disability Coalition, so we appreciate her. And with that, I want to thank you all for being here, and
Thank you.
take care. Bye-bye.
Bye.
Thanks, everybody.
Thank you.